healthcare system, and a system that empowers patients through both transparency and accountability. The President spoke last Tuesday, to a joint session of Congress, and he laid out his principles. First, wanted to make certain that those with pre-existing illness and injury were not priced out of the market. Nobody ought to lose their coverage because they get a bad diagnosis. In terms of affordability, health savings accounts, growing choices for patients is incredibly important. Tax credits that allow individuals to be able to purchase the kind of coverage that they want, not that the government forces them to buy. We've always talked about, in terms of what kinds of reforms need to be put in place, that we need to equalize the tax treatment for the purchase of coverage. Those, again, in the employer-sponsored market, they get a tax benefit for buying health coverage. Those folks that are out there in the individual small group market, no tax benefit, and that's what this plan would do. State flexibility. It's incredibly important that we allow the states to be the ones that are defining what health coverage is, have the flexibility, especially in the Medicaid program, to be able to respond to their vulnerable population. Lawsuit abuse, the President mentioned, and it's incredibly important. The practice of defensive medicine wastes billions and billions of dollars every single year, and we need to make certain that we're addressing that as well. The President also talked about a glide path, an appropriate transition to this new phase for health care for our country, and that's important as well, so that nobody falls through the cracks. Buying across state lines, buying insurance across state lines. The President talked about this on the campaign over and over. American people understand the common sense nature of purchasing across state lines, and it increases competition, and we need to make certain that that happens, and then addressing the incredible increase in drug prices. There are three phases.